to our usual seminars in that we're really doing it jointly with ILFS, and really pleased to be offering the space really for our colleagues from ILFS to talk about the reopening of the Independent Living Fund and the drive this year to get more applications in. There's certainly a time sensitivity around this because, as our colleagues will no doubt let you know, there's a certain pot of money that we need to get out there and get in use. So very much roll your sleeves up, listen to what's being said, give some really good consideration to putting an application in. And we're also pleased to be able to offer, I'm not sure if we've got them in the diary yet, but other spaces where you can come together if you're deciding to put in an application, sort of talk with colleagues and with ILFS colleagues around how to do that. So very much a kind of roll your sleeves up, this is how to get on with it. So I'm going to hand over now to Robert from ILFS to do the next bit of the introduction and then over to the programme. Thank you.
Thank you very much, Jane. And a huge thanks to Social Work Scotland for arranging this seminar with the SDS Practitioners Group and the ILF Leads Group. And yeah, it is very timely. The headline is actually, it's Run Seal, it seals the deal. Additional money to support independent living and ensure as many of independent living outcomes are achieved for people as possible. So ILF has reopened. I'm assuming that you'll have all heard of ILF. I don't intend to go through the history and the background of ILF. ILF is additional option 1 style direct payment for people who have an SDS budget. And currently the opening is open to people who have a budget of more than £800. That's been reviewed, and next year we hope to widen that access and also perhaps other routes to application too. The current route, as it has been throughout ILF's history, is via social work. So every ILF award, which is currently in payment, and those getting paid just now, are built on the foundation of social work assessment and the identification of need that is additional to that which has been assessed as locally eligible. And hopefully from today, by the end of today, you'll be much clearer about what that exactly means, what kind of target groups are, and to help you go back and identify those folk and make an application. And if everybody in the room agrees to do that and get one in and get someone else to get one, we'll be in a much better place. As it stands today, I think we have 293 applications in, which is good, but the financial year ends in the end of March, and the ambition is for us to get 1,000 applications in. The Scottish Government has agreed to fund up to 1,000 applications in the first year. Next year we hope more, but that's still to be decided, dependent on budgets. So what we do know is we have an opportunity then for more than 700 still applications to come in over the next few months, and the sooner they come in the better, so that establishes that funding is secured going forward year on year. So that's a brief introduction to where we're at in the current state of play, and I don't really want to go through much more than that. Happy to pause here if there's any initial questions. I'm happy to take them, and happy to pause as we go through the agenda at each point to take questions before we get to the Q&A as well, because I think we've got a good amount of time. Thank you all for being here, and if your screen's off, I'll assume you're munching lunch, which is what I do at these lunchtime seminars. Okay, back to you, Jane.
Fantastic. Back to me, Robert, and I'm just gonna pull up my screen so that I can take us through what's gonna be happening. So Robert, I'll go back to Robert and he can tell us a little bit more, because it's a good news story, and I think we need lots of good news stories right now. It's quite tough out there, and particularly tough for disabled people and their families. As we know, the latest campaigns about poverty and rights run by the Disability Alliance and others. So we know it's tough, but this is a good news story. We're going to talk a little bit about what the difference it makes having an Independent Living Fund Scotland award to people, and I know that Robert will guide us through that. I think we're going to have somebody's story around that, and then we'll look at the practical help that's available to you as colleagues, as local authorities, as people helping others to make applications. There's lots of support available, and so we can go through that. I'm going to talk a little bit about the direct payment agreement, because we've got a core component in there around the Independent Living Fund Scotland. And then, as Robert says, we've got time for discussions about what do we all need to do, and that's all of us need to do to increase the applications, and we've got time for discussions there. So I'll stop sharing my screen. I'm hoping that that just kind of helps people understand what we're going to be doing today. And then I'll go back to Robert to tell us a little bit more about, as I said, that good news story. Okay, thanks, Robert.
Yep, thank you. It absolutely is a good news story. I think that, you know, this was, ILF was reopened as one of the Feely recommendations from the Independent Review of Social Care in Scotland, and there was a strong campaign from disabled people's organisations for the reopening of ILF. When ILF closed in 2010, there were, you know, fierce campaigns to try and keep it open UK-wide, but it's only open currently in Scotland and in Northern Ireland, where we also work with colleagues over the water who we work closely with too. It's not open over there yet. The Northern Ireland Government is considering the proposal, and we're hoping to hear in the near future. The good news about the reopening for ILF is that each local authority has been allocated a set number from that 1,000, and the idea was to make sure we shared access geographically and based on a combination of disability, poverty, making sure that that was an appropriate allocation. So we have those numbers. We can speak to anybody who is interested in that in the local area. The ILF Leeds network has been a key group in working with ILF. It's a Social Work Scotland subgroup, and it's very, very useful for you in having questions answered and in being able to raise any difficulties or or actually things that you would like to see changed with ILF, because ILF is co-produced with all our stakeholders, including the fact that we are ran by a board of folk, most of whom identify as disabled, and our stakeholder groups who are folk using the fund, who have direct input into our policy and operational practice. So your feedback too from the front line in social work is absolutely vital, because we understand how busy that is. We do. Within ILF, our assessor teams are all former care managers in adult social care, either social workers or OTs. So we understand what your priorities are, and ILF traditionally, if you know of the current folk who have ILF, it's a review every 2 years, and we are still working through that cycle for the 2,000 folk who still have ILF. New applications in place. We will want you to make that application. We will then get in touch and be out to visit, and then thereafter get an award in place. It's currently taking around 10 weeks from application to payment, but we are hoping to get that cut by at least 2 or 3 weeks going forward. So that's a good news story, that folk will have that additional money in their pocket for them to use as they choose to purchase additional support or in other ways to meet their independent living outcomes. So that's the background and the current situation. I'm going to be ably assisted by a couple of ILF colleagues, social work managers Sandra Sweeney and Jill Fotheringham, as we go through the rest of the agenda. Back to you, Donna.
That's great, Robert. So Jo, I guess we're now looking to see, I guess, the difference that an Independent Living Fund Scotland Award makes. So Robert, do you have, is there colleagues or board members or video, or your part in terms of the people sharing their story about the difference that an ILFS makes to them?
Yes, indeed. Well, we are still working on the video of a young man who has recently made an application and the outcomes, the difference that's made already for him. But we can illustrate what an ILF award means, classic award. We have that video to show. And as part of jumping ahead slightly, the support available to everybody, I'll illustrate that using part of an open badge, which we'll come back to explain what those are about. Colleague Sandra, you want to come in just now and talk us through what you've seen as making a difference for people already? Are you there, Sandra?
I'm here.
Good stuff.
Can you hear me?
Yes, indeed.
Okay,
If you say your bit, then I'll actually, there's a 2-minute video from an existing recipient which I'll share for folks to watch.
Okay, I've asked each of the SDS managers to illustrate from their geographical areas an example, so we're demonstrating good practice right across the country, because there's four divides within Scotland. So I'm keen that we go to maybe Leslie first to give us a short example. Leslie?
Yeah, no problem. I'm going to try and share my screen. I've done a wee PowerPoint just so that people can match the visual. So hopefully this is going to work. Hopefully somebody will tell me as well, Robert or Sandra, when you can see this. I think it might just take a wee second. Right, hopefully that's
it, Leslie.
Is that working? So I just wanted to share a case study from quite an early application that we'd been out to support in the West team. So I have changed the names just to anonymise this, but it's a very straightforward application, and I think we got from initial application from the local authority to payment in about 8 weeks, which isn't too bad, considering it's the school holidays and things as well during that period. So Shirley was a 62-year-old lady who lives in her own tenancy. She has secondary progressive MS with very complex health needs and has had a lot of hospital admissions. The local authority provided 39 hours a week of support, which included a 2-to-1, some aspects of 2-to-1 support for personal care. Her daughter was also providing a lot of informal support, whilst also juggling these with a very young family in primary school and full-time employment. So she was really exhausted, actually, daughter, when I met with her on initial visit, and quite stressed. The applicant was also, you know, Shirley herself was quite lonely. She was quite bored. She was a really chatty lady who clearly enjoyed social interaction, but just didn't quite have enough hours anymore in order to get out into her community and do the things that she wanted to. So just to talk a wee bit through, the initial process was that we got the application and the support plan, which was incredibly helpful from the local authority at the end of July. That confirmed the local authority input was around 38 hours a week, or at 22.90. So they clearly met the access principles in terms of the minimum, the threshold sum, sorry, of £800 per week. The request was for additional support to alleviate the stress on the informal carer. That was what the initial application said. So again, the access principles, in terms of additionality, it wasn't something the local authority were able to fund at that time. It was very much about providing something additional for this lady and also for the informal carer. The visit was arranged for the end of August. There was a slight delay just because of summer holidays. So I met with Shirley and her daughter in Shirley's own home alongside the social worker. The SDS support worker actually came in that case as well, just because it was one of their first applications, and they'd also known this lady for quite a while, so it was really good to have people around her that were familiar to her. It wasn't scary, it was in an environment that she knew well. We did a lot of chat about what the things were that were important to her. You know, she really missed going out shopping, and she had a favourite shop. She loved going to Marks and Spencer's, and it was really important to her to be able to go there and to choose her own food for her evening meal, and they don't deliver, so it wasn't like online shopping was an option or things like that. And she quite liked going to get a coffee done. She'd said to her daughter she'd really like to go get her hair done more often, but her daughter was working full time, juggling young children and all the additional activities that go with that. So we kind of talked a bit more, and our daughter was saying, you know, even when she does have time, she was having to go back to do top-up shops for her mum. She was having to support her to a number of medical appointments. She was having to, you know, even simple things like the care provider that she had for her personal care wouldn't be able to do small tasks like run to the chippy on a Friday night and get her, you know, a wee treat like a small fish supper. Simple things like that mean something to people. It is something that people look forward to, and we know that that's preventative in terms of people's mental health. And also, you know, just helping people feel part of the community and having some enjoyment. So initially only 8 hours support was applied for, and that was primarily to get her a wee bit out of the community and do some shop. But when I went out and did my assessment, you know, I felt this lady and her informal carer would really benefit from an additional couple of hours on top of that. As I said, all the access principles were met. The applicant and their daughter had a list of approved care providers from the local authority with a wee bit of guidance from the local authority about who may have capacity. The daughter was able to support her to make some calls and identify someone. I completed the report, recommended the 10 hours agency support at £23.50. So that's an additional £235 a week of SDS budget, well, self-directed support budget from ILF available to this lady. And it works out about £12,000 a year to that local authority. So it does really add up over the months and make a real difference for people. Neither the applicant or our daughter were really in a position where they felt able to manage the award, just far too much going on. And the lady herself was beginning to have some cognitive difficulties. So we had agreed to make a referral for third-party award management. Is that something that's familiar to people?
I'd imagine there'll be some people, Leslie, not. And if you want to give a minute on that, feel free.
I'll give a wee brief explanation. So we have a number of third-party payroll providers that we work with. Now, we only have 2 at the moment. Or no, we've got 3, is that right, Robert? 3 who can do award management. Award management means that they will manage the bank account for the person, but they can also action any changes required. So they're able to get directly in touch with ILF Scotland and say, if the provider rate goes up, can you please uplift this and deal with any difficulties that might arise with invoicing and so on. It's a bit more than just a managed bank account, whereby you'd still rely on the person themselves authorising or seeking support when there's maybe a letter from the care provider saying our rate's going up due to Scottish Living Wage. So that would all be taken care of for them. So I made the referral to ICMS, who opened a bank account for this lady and made the introductions, and the offer went into payment just at the beginning of October. And you know, the lady is now able to get out in her community, and her daughter's just saying it's like a massive pressure that's eased off her mind. So it feels like a really good piece of work. We'd like to do many, many more of these sorts of applications. So please feel free to get in touch with any of us.
Thanks, Leslie. Thanks,
Thank
Leslie.
you.
Do we need, Maria, I know you've got an example as well. Hello.
Oh, I'm going to jump in the silence.
Okay, no, I'm just going to go to Debbie, but on you go, Jill. Sorry, on you go, Jill.
I don't mind waiting. I just saw that, seized that opportunity. So just very briefly, so I'm the manager for Central Team, and I've got 2 examples. One from colleagues in my team, one which is a Fife Award following the ILF assessment. The new recipient has been able to increase the hours provided by the team who already work with her, who she already knows and trusts. This means she's able to pursue her passion for the sport she loves, and has been the difference between enjoying this couple of hours per week and now preparing to compete for her country. I think it might be boccia. I hope I've said that right, but I think that's the sport that person has a passion and is really good at. And the other one is from North Lanarkshire, and the additionality of the ILF funding will support the person with re-engaging in community groups, developing and building up new natural friendships, improve their communication skills, address the recipient's social isolation, and generally improve their health and well-being. The additional support will address social isolation the experience experiencing, promoting their independence through enabling the recipient to demonstrate choice and control, to feel safe and secure, and supported to access their community and friends. That award is for 12 hours of agency support to complement the local authority funded support that's already in place, £264 a week. And the other one, I actually don't have that detail, sorry, but again, it's about complementing the local authority funding that's already in place for the critical and substantial support needs of the person.
Okay, thanks, Jill. Poor Mary get kicked out, actually. That's why we were sitting in silence. So apologies for that. Debbie, I know you've got one case. You're back. Okay, sorry. Debbie, do you want to go then and let Mary come back in again? I know you've got a case in Glasgow.
Yeah, so I had an application that had come through for an 85-year-old recipient. So she had a hearing and visual impairment and communicated via British Sign Language. In addition to this, she also had a diagnosis of unspecified dementia. This lady was living at home with her son, who was her main informal carer, but he really was experiencing significant carer stress. There was another son who was helping out in an informal caring role, but was quite limited due to his work and family commitments. So in the application, the local authority were meeting threshold. They were funding all critical personal care needs. So that was the 4 visits daily. There was also a direct payment for some PA hours for carers' respite. And the lady was also getting support from a specialist service to support her with her communication needs. But she had very little or very limited opportunity for social engagement. So I was able to go out and do the assessment, which was attended by the social worker, family, everyone that was important to this lady's life. And there was a lot of discussion about how ILF could really help this lady. And from my assessment, I felt that 20 hours of PA support really would help to enable this lady to do the things that she enjoys in her community. Her faith was really important to her, so she wanted to be able to get to chapel on a regular basis. She really liked to go out shopping, meeting up with her friends, going out for a haircut, all of these things that she wasn't really able to do without the ILF funding. So she was experiencing loneliness and social isolation. In addition to this, I had felt that the ILF funding would also support the son, who was our main carer. It would help to significantly reduce carer stress. It enabled him to recharge, and it was giving him the time to continue to provide unpaid support, as well as reduce that risk of a breakdown in the family home circumstance. The lady had always been clear it had been her wish to remain at home, so that top up of our support has really enhanced her quality of life and also offered the carer support in terms of his caring role. So our award, I think in total it comes out at £290 per week, and that includes all of the employment related costs and the payroll costs for the GSIL service. So that's another really positive story.
Thanks, Debbie. And I think that clearly illustrates somebody being supported at home rather than potentially a residential or nursing care transition. So that's about supporting somebody to be at home, supporting the carer in that, and allowing people the choice and opportunity to continue to be as independent for as long as possible. So thanks for that. Mary, are you able to come in?
Can you hear me?
Example. I can hear you fine, yes.
Oh, okay. Yes, apologies. My laptop is playing up, but I think all of the examples that we've heard are really positive, and there's just numerous examples that show the positive impact that the fund has made. And one of the visits that I was involved in was a 63-year-old man with very advanced MS. He had a significant package from the local authority. However, that was for personal and critical care, so there was no social support in place whatsoever. The social worker had gone back to the funding panel, I think probably at four occasions over the previous 2 years, but on each time it had been declined because it didn't meet the current funding criteria. So he applied for, or the social worker on his behalf submitted an application which was for social support. And on the back of that, he received 24 hours of PA support because he needs 2-to-1 care. The maximum that could be provided within the maximum award was 12 hours. However, he described that, and actually his daughter sent an email. He described it as absolutely life-changing, and so did his daughter. Again, she had her own responsibilities. He also had 2 sons, but they lived further away. And his daughter said that, that allowed her to then focus on her own family responsibilities, and also had a positive impact on her mental health, knowing that her father was able to go out. So I think sometimes the positive consequences are really far-reaching of people getting an award. It's, it's looking at the whole picture. It's not just, sort of the impact on somebody's condition. It's actually allowing them to experience just everyday opportunities that we take for granted, whether that is going for a coffee, whether it is meeting up with friends. This man had lost all his social supports and relationships within the community over the years. And he has said that actually it's been life-saving for him. His mental health had really deteriorated. So whilst there's also some very innovative uses of the fund, sometimes it's just about providing the additional hours that allows somebody to go outside, to meet up with folk, to get some fresh air. Sometimes it's these tiny little things that can have a huge and positive impact on somebody's life.
Thanks, Maria. It's really good. Thanks to the 4 SDS managers for really good, comprehensive examples of how the ILF funding has made significant differences to people and their family lives. Thanks for that. Robert, I'll hand back to yourself.
Yep, thanks. That was excellent. Can I quickly check, has anything jumped out? There's been some chat and some answers and questions in the chat. Has anything jumps out there just now? See if there's any hands up. 6 screens. Goodness. Okay, no, that's fine just now. I think I was going to show that short video of an existing award, but I think those illustrations were absolutely brilliant. So we'll move on, and when we have the video on our website, of course, we can send links out to anybody who's interested. When you go to our website, you'll be able to see how to make an application, what the access requirements are, and examples of what people have used an ILF award for. So I think we're ready to move on to the next item, Donna.
Yeah, I think, Sandra, do you have your hand up there? Please come in.
It's okay. No, just to add to what Robert said, we've hosted engagement sessions right across the 32 local authorities. Well, almost the 32 local authorities, a couple of exceptions to that. If there are any teams that you feel would benefit from an engagement session, we're happy to come along to that, to meet the team, to explain the process to the team, and just extend that information right across the 32 local authorities. So don't hesitate. If you'd like us to come to your teams, please contact me and we can get something set up relatively quickly, and maybe plug into your team meetings or your peer group meetings or whatever. Happy to do that.
Fantastic. Thank you, Sandra. I think you're going to be busy. I mean, those stories are very powerful, and like you say, the impact is broad. So thank you for sharing that. I think our next bit is really about the support that has already been developed by Independent Living Fund Scotland and by local authorities in terms of support to make those applications and to help people through the process. So I know that they've been very, very busy. Remember, this has been a quick opening. People had to kind of hit the ground running, and they have. So I think Robert's going to tell us a little bit about the open badges, and there's obviously the Practice Network, another source of information and support for you and local authorities. And then I'll talk a little bit about the direct payment agreement, Robert. So thank you. Over to you for the open badges. Thanks.
Excellent, thank you. And in true social work fashion, that when you can, I'll delegate this to Jill, social work manager for the Central Scotland team. Jill,
yeah,
okay.
Thanks, Robert.
To share, thanks.
Yeah, thank you. Yeah, so yeah, we've got an established network of support and communication with all the local authorities that Ron already touched on. We have the ILF Leads Network that Robert is now the chair of, and the meeting. So there's an ILF lead in every local authority, and the Leads Network meetings are hosted every 2 months. So we have there was supposed to be a meeting today, but we've used this opportunity to come together with everybody here, which is amazing because there's 83 people on the call. So the next meeting is going to be in February, and every ILF lead will be invited along to that meeting, and that extends to any other colleagues within the local authority who would find it useful to come along either with or instead of the ILF lead. So you can either link with the ILF lead or speak to any of the SDS managers that you have contact with, or indeed contact the office, and we can add you to the invitation list. Also, as part of our portfolio of what we can offer to local authority colleagues, our colleague, Kath Montgomery, has been collaborating along with key local authority partners, other staff and Independent Living Fund, and people who receive our funding, been working together, collaborating with the SSSC to develop open badges. So there are 6 open badges that have been developed, and essentially it's about providing information to local authority colleagues so that colleagues understand what Independent Living Fund is, what the aims and objectives of our organisation are, how we want to work in partnership with local authority partners, and the ways in which we can do that in as straightforward and easy way as possible. And I mean, essentially it's about upskilling workers' knowledge, skills and understanding so that we can achieve positive outcomes for the disabled people who receive our funding to live independently. So we don't have time to really kind of drill down to the 6 badges. So I'm really just going to share my screen and highlight one of the badges. So I don't have my share screen button highlighted, Callum. I'll
Already?
What? So while Callum's sorting out, hopefully that's going to be okay. Just to briefly state what the modules are. Module 1 is Introduction to ILF Scotland. Number 2 is about the access requirements or eligibility criteria for the funding. Module 3, ILF Scotland policies and responsibilities. Module 4 is the ILF review process and care schedule. Module 5 is an award manager resource, and module 6 is the reopening module. I'm trying to talk as slowly as possible. Is everything okay, Callum?
As far as I know.
So that's it. It's gone on. Thank
you
very much. And Linda's got her hand up. Hi, Linda.
Hi, it's actually Naima. Sorry, we're just using Linda's laptop.
can I expand on Mary's response and Helen's question? So we have a few supported living setups in Dundee where there is shared hours, background hours, and individual one-to-one hours. And one of those individuals in that supported living setup, we are just putting through for the ILF award. So I'm just wondering, would that be applicable for this young person? Because he has got shared hours, background hours, and individual one-to-one hours. Got them all of them in the supported living setup.
Jill, Naomi, can I suggest that we'll come back to it? If it was about the open badges, I would happily go through this, but we're going to come round
no, that's
to
okay. Apologies.
Just not at all. We did invite questions.
Thank you.
Come back to it, definitely.
All right, okay. Right, well, without further ado then, I'll share my screen. And could somebody give a thumbs up to let me know that that's now, you can see it? Yep.
Yep.
Don't know how to do a thumbs up, but it's there.
It's there.
All right. Okay, so what the badge that I've chosen is the module 2 about the access requirements or the eligibility. So as you can see, when you open up the badge, so these badges are going to be on the SSSC website that all social care staff can access, and I mean, it's really quite straightforward. They'll kind of open up the badge and then work through the chapters. And as you can see, there won't be time to read, I'm afraid, sorry. But as you can see, there's an introduction about what this badge is about the criteria, about ILF funding and the relationship between the ILF award and the SDS budget, introduces the concept of rebalancing, which is something that assessors and social workers will talk about at review to ensure that the local authority is the majority funder. And it just takes you through everything. We have some helpful information from Joan, who was on the project working group, and Joan receives receives ILF funding. And you work through the badge, and here's a bit more information about the different types of awards and why they're different. And every badge has information and a video that I'm not going to show this one because I think this one takes a wee bit too long, but there's a video kind of synopsis of what the worker is reading and learning about, and there's a transcript of every video as well. So the idea is that the worker will work through and get to the next chapter, work their way through that. I'm pausing at this chapter because it's about additionality, and it's something we talk a lot about when you're making your applications for a reopen fund, and also when it comes to the assessor meeting with a potential recipient and the social worker to make an assessment of what an ILF award could be. So additionality gives you an overview of what additionality means. It's about what sits on top of the local authority funding that can't be funded by the local authority. And these videos are, I'll pause it. I'll just pause it for a minute. These videos are really, straightforward, short. Here we go.
Jill, I'm not hearing that. Yeah.
You can't hear it. All right. Oh, well, not to worry.
I think you might. Sorry, Jill, I think
it doesn't
you might have
matter.
to press the speaker thing down at the bottom right-hand corner.
Okay, it doesn't matter. I think by the time everybody's read it, it's so, I mean, it's really just saying what's on the screen. So, and again, there's a transcript, and you know, once the next chapter, you know, once they finish that chapter, we'll move on to the next one. Each chapter has a summary, an overview of what the workers read about and learned, and then there's a quiz. And yeah, I got 100% second time. But yeah, so there's a quiz, and you know, hopefully it's a little bit of fun as well, or you know, enjoyable learning. And once that you've completed the quiz and got 100%, it takes you to the next stage where you are, you know, you can, well, you get your badge, and you are then guided if you want to upload your badge onto your SWSC account that can then be used as part of your portfolio to evidence continuous professional learning. So that's really it. It was really just to give a very brief snapshot of what the badges are, and there's 6 of them. They're not on the website yet, but there will be, and there's plans for information also to be added to our website that I have to say is another source of heaps of information and straightforward guidance about just to help staff you know, kind of enhance their knowledge and understanding of what we're all about. And just a final thing to say, we also have leaflets that we can, I mean, I've used this leaflet when I'm going out. I can't get my screen because of this background to, there we go. Yeah, these leaflets are really helpful when you're going out and talking to potential recipients of our funding. We can deliver these leaflets out to you know, the teams, local authority teams, and that's again just another tool for workers to use when they're talking to people about Independent Living Fund. That's me.
Excellent. Thank you, Jill. Over to you, Donna, for the SDS Standard 13.
Yeah, fantastic. I think it's great. We've heard, you know, the good news story. We've talked about the impact on people. We've heard about the practice resources that are around. So now I'm hoping that part of the work that we are doing within the team, within Social Work Scotland, is also going to kind of give some more help and context to that. So let me just go on to my next screen. You don't need to see all of that. Let me just hide the view. So as you'll know, many people in the room, we are in the process of developing a self-directed support standard 13 on direct payments for employing personal assistants. This is both a privilege to the team and also a mandate from the PA Programme Board, which has been funded by Scottish Government Fair Work Division. And that's really to try and address consistency and better outcomes for disabled people and PAs. So as you might know, our standards were endorsed by both Scottish Government and COSLA. They're easily accessible on the Self-Directed Support Library, which is located on the hub, along with lots of other practice resources. And the standard at the moment is in a draft stage. It's been tested by people with lived experience and by local authorities. And it will be refined and go back to the PA Programme Board at the end of this year to then go to COSLA and to Scottish Government. So it's just to say that our standards have a descriptor. I'll not read this out, but it's about what good self-directed support looks like. And the standard 13 is underpinned by, it has the foundation of all the other 12 standards. And each of our standards describes what it should look like for the people, the person, the family, the carers, and also that practice statement about what local authorities could be doing in order to reach that standard. So each of the standards, let me go through to the next one. Each of the standards has core components, which are the key ingredients, and that's what you saw in the first slide. But in order to use those core ingredients well, we need to know the how to bit. And I've just pulled out some of the key things in here, which I think are probably most relevant to our people in the room today. But it's very much about those strong relationships between our practitioners and independent living fund assessors and our independent support organisations, who are key, as we know, in supporting disabled people to be employers. It's also about social work practitioners understanding the independent living fund values and that concept of additionality, and we know that's been picked up in the open badges. It's about social workers and everybody putting people at the centre of that relationship. It's about making it easier, and we know that social work practitioners are being supported in lots of different ways, including the badges. And this is also our plea from disabled people and families is about reducing unnecessary bureaucracy. Some of the feedback from the testing around the standard and that core component was about, it was complex, there was a lot of paperwork, there was a lot of things to be done at different times and in different ways. So there was a plea to kind of reduce any unnecessary bureaucracy. And at the end of the day, it really is about supporting employers to be good employers and achieve personal outcomes and independent living. So it's just to say that we are open to anyone who wants to engage in this, helping this standard kind of get over the line. And we're very pleased about, I guess, everybody's involvement and keeping everybody in play at the moment. But our part within Social Work Scotland and within promoting and implementing good self-directed support is to have within that standard that core component on the Independent Living Fund. We learned a lot from the opening and we've been part of the co-production working group. So we hope whatever is in the standard reflects both lived experience and the experience of our practitioners and leaders. So thank you very much, Independent Living Fund Scotland, for being involved in that standard, and we're looking forward to getting it over the line. So thank you very much. I'm going to stop sharing. Thanks, Robert.
Yeah, no, thank you, Donna. Obviously, our interest is dead simple. Local authority social work, you've, apart from the statutory work day to day and the 65,000 people who have got a social work service and the 12,000 who are waiting for assessment or the start of one, there is a couple of thousand folk with an ILF direct payment just now, and hopefully by the end of this year, with your help, that'll be up to 3,000, and that's roughly about a quarter. Or between a quarter and a third of all the direct payment funding in Scotland. So that's why we take a keen interest. We want to make sure that our policy and practice is the best it can be, and we're a bit like a magpie because we're not tied to any one local authority's eligibility criteria or operational practice round about direct payments. We can choose to pick the best, and again, we are not tied to statutory provision as a discretionary funder, so that gives us a bit more flexibility and speed to adapt to change. So look, thinking of a direct payment that you may have put in place, ILF is very similar, perhaps with less restrictions, to put it, oversimplify it, and the review is every 2 years and not quarterly as it is in most, I think, most local authorities of a direct payment. So I think we've gone through the agenda, Donna, and we're at the part where it's open to question. I've seen from the chat though, Peter Scott is Chief Executive of ILF, and Peter, do you want to come in and give a wee update on the continuing co-production of the Reopen Fund, because work is still ongoing?
Sure thing, just quickly. So I suppose the first thing to say is that the access principles, as we're calling them, rather than eligibility criteria for ILF, were developed through a pretty extensive co-production process, and that involved most of our main DPOs and CILs, some VOLORGs, CCPS, Scottish Human Rights Commission, Social Work Scotland and COSLA, and a few individual local authorities also were all represented on the co-production working group. And essentially the criteria for accessing ILF is really simple. It's age 16 plus. Somebody had asked a question about the age. 16 plus, and a threshold sum, which is the minimum local authority SDS budget that the applicant needs to have of £800, a maximum ILF award of 330, and key to all of it is this principle of additionality, where the ILF award must be additional to the statutory provision that comes through SDS assessments. So we are designed not to fund anything that the person would be eligible to be funded for through local eligibility criteria, and that's really important. There was a question from Helen, I think it was, in the chat about unpaid care and the relationship between unpaid care and the threshold sum. So the co-production working group designed these criteria in the knowledge that things would have to change over time. We were anxious to get the fund up and running as quickly as we could from April of this year. So we made some compromises, and the group set 3 key priority areas that they wanted to focus on in the first year in terms of development of the policy suite. The first one of those is about recognition of the impact of unpaid care on someone's ability to meet the threshold sum. So the group were conscious that there would be a number of people who, because they essentially had a deflator applied to their SDS budget because they had significant unpaid care, that they would not meet the threshold sum, not because they didn't have significant levels of need, but because they had significant levels of unpaid care. And the co-production working group have been trying to devise a means of recognising that. This isn't finalised yet, it's work in progress. We're meeting COSLA next week, and the following week is the next meeting of the co-production working group, when we hope to get approval for a slight amendment to the policy, which will then go to the Minister with a view to implementing that from as early as we can, probably early in the new year. But essentially the proposal as it stands at the minute is that where someone an applicant lives with an unpaid carer, then we will make a notional contribution to the threshold sum of up to £315. I'll not go into the rationale for that figure. So in effect, it brings the threshold sum for application down from £800 to £485. So where someone has significant unpaid care in their life, and that's resident unpaid care, so the unpaid care lives with the person, then the threshold sum will in essence be £485, and we think that'll bring quite a significant number of people who are currently out of scope into scope. So hopefully that answers your question, Helen, but that's in development at the minute, and with a fair wind we'll have that in practice from early next year. The other 2 areas that we're working on at the request of the co-production working group is the threshold sum itself. So we know that the threshold sum is not a perfect means of determining who will benefit the most from ILF, who are the people who face the greatest barriers to independent living. It serves a purpose, but there's recognition that we can probably design a more sophisticated mechanism for determining who it is we're trying to target, and that work will take a wee bit longer, but that's work that's underway as well. And the final thing that the group asked us to work on was a citizen-led application. So one of the key learning points from reopening of the fund so far this year has been the capacity of local authorities to support applications. We were aiming for 1,000 applications. We're over halfway into the year and we're still at less than 300. And feedback we're getting lots from our local authority colleagues is that social workers' capacity is really stretched, and there's lots of vacancies in social work, and you're having to prioritise obviously protection cases, emergency situations, etc., and you just don't have sufficient capacity. So the co-production working group asked us to look at alternatives to social work-led applications. That was the only route we could go down to get opened in April, but there may well be alternative ways that we can accept applications into the future. That too will take quite a wee bit of time, but we're working on that at the minute, with the ultimate goal of having citizen-led applications where the social work will go from leading an application to essentially just verifying the application. But again, that's work in progress. I don't know, Robert, do you want me to say something about the allocations? Is that helpful at this stage?
Yes, but yes, and I think Sandra, did you have a breakdown? I think Sandra had a breakdown to share because we were anticipating some questions about that.
Sorry to interrupt, Robert. Why don't we pause there, because I see a couple of hands up for questions. So maybe take those questions and then we can return to that.
Yeah,
Helen.
Yeah, right.
Oh, Helen.
Yep, Helen has her hand up. Yep.
Yeah, sorry, Peter, you said about this, obviously the carer budget and whatever. Could ILF do a wee statement about what you're actually trying to say to make sure we actually communicate the correct information to our staff? Because I think that might actually bring in more applications, because I think that might help a wee bit as well, because obviously that's a question I think I had in one of your other briefings. You were considering it, and so I think it'd be really good for a follow-up on that. So, and because I'm meeting our senior management next week about it again, and it'd be good if I could feed that back to them.
Yeah, so it's work in progress at the minute, Helen. So once it's finalised, we will do broad communications to make sure everybody's aware of that change. At the moment, it's work in progress. If things go to plan, we'll talk to COSLA next week. The following week, the co-production working group hopefully will agree the proposals and make the recommendation to the minister, and then it's up to the minister to consider the recommendation. And assuming the minister is content, then we'll implement it as early as we can. So it could be as early as January, all being well. But as yet, I'm being really careful to make sure everybody understands it's work in progress rather than policy at the moment. And somebody else, Linda.
Hi, Peter. Sorry, it's Linda and I sharing a laptop today.
Yes.
Just a question in terms of this may just be a Dundee specific issue. It may not be the case in other areas. However, we did a scan of in Dundee. I manage the mainstream locality teams, which is the more generic team and includes older people, and we do have our specialist LD teams as well. But scanning the group of people within my team, we have a vast amount sitting at around about that £650–700 threshold. And people who get older people predominantly who receive free personal care, double up 4 or 5 visits a day, and that's their majority of their care. They would absolutely benefit from social hours coming in that ILF could be used for. And I was typing it, but now that I've had the chance to speak, but I think, is it something to consider looking at that threshold? Because certainly we are struggling to maybe get to the numbers been allocated to Dundee, but we are trying very hard and we're looking at what we can do. However, we would definitely be reaching that target plus more if that threshold was reduced just even from 800 to 700, but certainly 650 to 800. I think that's the case in lots of areas, because we all know we have more people living in communities. They live, it's brilliant. People live longer, but they have higher needs, and majority of free personal care packages, double ups, and that social element linked into the isolation element is really missing. So
absolutely,
I don't know if that's something that but I would be asking if that could be actively explored, because I think that's the best outcomes for people in Scotland. Sorry, that's my that's me.
Listen,
thank you.
No, listen, that's really helpful. Thank you very much for that. I mean, it is interesting, the average local authority input, so the average SDS budget for applicants to date of the 300 or so applications we've received, the average is over £2,250. So applications are coming in with really high levels of SDS input at the minute, but we're also getting lots of feedback that people wish the threshold was a bit lower. The threshold is being reviewed, both in terms of what it is and in terms of whether or not there's something better that we can use. And there's a few suggestions on the table around alternatives to a threshold. But in truth, these changes will take a wee bit of time. The care component one we can do relatively quickly. The threshold review will take a bit longer because it's a lot more complicated, but that is something that we're very mindful of, and a number of folk have said if the threshold could come down a bit, it would really help in terms of the number of applications. So yes, that's certainly something being considered, but I can't promise that'll change as early as January, unfortunately.
That's great, Peter. Thank you.
Thank you.
Excellent. Donna, I think we're in good time. That's 2 o'clock, and we're now at the stage of just being open to question.
Robert,
has a hand sorry, up, do you want to share the local authority if I can? I've got the local authority allocations here if people are interested in that.
Elaine's got her hand up first.
Yeah.
Go ahead, Elaine.
Sorry, it was just to I'll put it on the chat about the £800 threshold. Some of our frontline care managers are querying, like why it's £800. As I say, I come from a learning disability background, mental health background, where there are significantly large packages within my local authority, where people have Well, you know, they meet the £800 a week, which is a huge support package for people who are living already, and the kind of consensus for quite a few frontline care managers is that there are those who have a lot lower packages, but you hand it on, Peter, you know, who could benefit more for the social support. You know, the consensus is they've kind of got it back to front a wee bit, where folk maybe who have a lesser package would benefit more for the ILF funding. Like in previous years, when way back when it was £250 was the qualifying mark.
Yeah. So the qualifying was £340 when ILF closed, and if you simply uprated that for inflation, it would be around about £800 now, the exact same amount. I know it's an astonishing increase over that time, but essentially it boils down to 40 hours at £20 an hour, or 6 hours a day. ILF is targeted at those with the most complex needs, and it's targeted at those who have got unmet need. So it's not for those who have all or almost all of their need met through your SDS budget. I am sure that every single practitioner in the room will have people on their books who they know has got unmet social care needs, and ILF is potentially appropriate. And that's the folk we were desperately keen for you to identify and start sending through to us. The changes Peter's outlined that may come next year, absolutely widening access will get to another group of people, but ILF's key priority is to fund those people with complex needs and unmet need.
Yeah, it's far from perfect. Elaine, we understand that the threshold isn't perfect, and you know it is work in progress, and we hope to get something more sophisticated. ILF is designed for those with, as the Scottish Government describe it, those with the most complex needs. We're trying to shift the thinking around that to those who face the greatest barriers to independent living and who need that support to overcome those barriers. And obviously there's a strong correlation there, but they're not exactly the exact same group of people. So this is work in progress that we will return to this in due course, but we'll understand the frustrations, and no matter where, if we use a threshold, no matter what the threshold is, there's always people who just miss out regardless of what it is, you know.
I think the new eligibility criteria many local authorities are reviewing, you know, they've got new sort of complex and critical. There are people going to lose out on a lot of stuff. Absolutely. So it was just what's being raised on the front line to feedback.
No, absolutely. Thank you very much.
And Grant, you've got your hand up.
Yes, hiya, Robert.
Hi, Grant.
I have a question about resource transfer, right? So I know this is something ILF don't really consider, but I actually wonder if there would be even a rethink on that, just based on the fact we have people from, say, the last 15 years or so that have got support plans that were developed when ILF wasn't available to them. And is it possible this could be rediscussed to see if those people could be able to access the fund in some way?
So ILF has been closed for the last 14 years, Grant. You're absolutely right. And what is it you need to just clarify with resource transfer?
Resource transfer. So if we have people with existing packages of care where in the past, had an ILF award been open, we would have maybe looked at developing the support plan with an element of ILF. Now, because that provision's now being met by something funded by the local authority, we seem to be in a position now where those people, because the provision's already been met, they don't perhaps need the ILF input.
Yep, no, it's a great point. When ILF closed, there was no SDS. ILF at the time funded significant amounts of personal care because what was locally eligible need was much less clear. And I know that myself, having made many ILF applications when eligibility criteria were still much wider than critical, substantial, moderate even. So ILF's opened in a new landscape, and I think this is partly the reason why we're given the steer that it has to be truly additional to the local eligible need. We could fund personal care if that was the choice of the person, supported by the social worker, that's what they wanted from ILF, as long as it was not local eligible need. So that's going to vary across partnerships across Scotland. There'll be a different interpretation of that. And so that's why we do the visit at the outset with you, to make sure that it is additional and set the ILF off on a good footing. But yeah, in some ways, you're right, local authorities have had to find that additional social support that was there when ILF was open. ILF was definitely part of the design of many people's care plans, support plans. And now that we're open, what we're asking social workers to do is hold a kind of twin track plan in your mind. You have to complete an SDS assessment, as you would, according to your local eligibility criteria. And now there's this additional national resource which can provide to meet additional outcomes, which are barriers to independent living. So that's where we're trying to shift understanding of ILF to. I don't think I answered your question. Did that answer your question, Grant?
Well, it's if I've got somebody, say, that's sitting with us and they've got maybe 30 hours a week non-personal care for social support, is there a way, can they apply to the ILF award and actually get some of that local authority funding replaced by ILF funding?
No, that's a great question, and I'm glad you've raised it, because that's an absolute line in the sand. The answer is a very clear no. Delighted you've been able to do that. And of course, if that was the case, there would be no or very little need for the National ILF resource to sit across local eligibility criteria, because of course the huge benefit of that local choice and flexibility is that it's designed locally for the person, but the inconsistency and unfairness is that eligibility criteria is very different from area to area. And as somebody that lives in South Lanarkshire, if I lived across the motorway, I would get a different support plan from the neighbouring local authority. So ILF is in part at least an attempt to provide some national consistency and fairness for those who are eligible. So resource transfer is our absolute no. That's something the assessors are being asked to look for to make sure that, and we know this is tricky because a lot of budgets are being reviewed. There's been a lot of reductions to manage budgets. And at the same time, ILF is open and we're saying, we want you to come and ask for more support. So again, that's tricky. Social worker has to complete their SDS assessment and then have this additional ILF in mind. You can't count ILF as a fixed asset in your assessment. It's within ILF's control how the budget can be used, and it cannot usually be used to replace care that local authority provided.
Okay, I felt it was a question that needed asked. Thanks, Robert.
Absolutely. Thank you. Jill?
God loves a trier. I've got to say, God loves a trier. Well done. Well done.
It was just really to highlight the question and the point. It's maybe a takeaway for us from Samantha in the chat that in their local authority, they calculate the budget and then they deduct the person's contribution, which may take the budget down below £800. And, you know, I don't know if you want to comment on that, Robert?
Yeah, I'll just clarify in the chat that if your net budget is below £800, then you don't currently meet the access requirements for ILF being reopened. Obviously, we hope that all non-residential social care charging will go. And I put in the chat to clarify, in the reopened fund, there is no charge from ILF. If the person has a charge from yourself and the partnership, then that would stay in place. In the old fund, of course, just to slightly complicate it, there is an ILF charge. But again, if you go through the open badges to add in the hours to the CPD, you'll learn all about the detail of that. Duncan. Hi, Duncan.
Wanting to, it might be helpful to reprise a conversation that we had on Monday about additionality and demonstrating additionality for people who are already on 24/7 care packages. It was, you know, kind of our thoughts that it's actually quite a straightforward thing to do, particularly for the coming home group. But we had a little bit of inconsistency in responses to applications on that basis.
You're right. And so to clarify, the coming home group who each local authority has taken their own approach to identifying potentially eligible folk to apply to ILF. I know, Duncan, you said in Midlothian that you were looking at those folk who were in the coming home group, and that means people who have the highest complex needs and who usually would have packages of support of 2 to 1, even 3 to 1. If that support meant that that person was unable to access the community to achieve some key independent living outcomes, or there were barriers to it, not just classic support such as provider or agency, but others, more creative supports, as West Lothian are trying with your partnership in the Pavilion project, which is a way to get folk who are not leaving the house out the house, but they need additional support to do so. Then ILF can fund that. Yes, we can. It has to be a conversation about the additionality, because what we want to drive is make sure that this new money is being used for the best outcomes for disabled people, and it's not income substitution for local authorities.
Yeah, I think, yeah, it's actually Midlothian, Robert, that I'm from, West Lothian, but
not West, beg your pardon.
yeah, but that's quite right, particularly for young people with the most complex needs in transition, and just getting away from the assumption that everybody's needs will be completely met if they're on a 24/7 package. It's the same for everybody else, same as everybody else.
Topic. Does anyone else want to come into that before I go to Jill? Hi, Eileen.
I think that when we discussed it with our heads of service, the transition is quite an important one, with young people transitioning from children's services into adult services, and they might be a sort of target group who would be beneficial from the social supports if all the other unmet needs were met via the local authority funding, because they are coming through with 2 to 1, 3 to 1 packages. It's how you look at that. So there's huge discussion going on in East Ayrshire about the transition stuff. So and that one definitely came up.
Yeah, and of course, if a young person's in transition and you're setting their first adult budget, and that happens to change from their child budget, which often it does, let's be honest, we will not consider that a reduction. That's not resource transfer. We would like to be part of that planning for those eligible young people.
Great.
Oh, Fiona.
Yeah, that was really the question I was thinking about earlier, was just about transition. So when young people are leaving school, there maybe they don't reach that level of the 800, but there would still be that need for additional support. So I was just wondering how that would work.
Could you say that again? Sorry, I froze slightly.
No, I was just wondering how this would work alongside the transition support, the transition fund. It's not really a question. It's just a comment.
No, absolutely. No, we have our transition fund manager Ian on the call, I think, and of course at some point it had to come up. Good question, because we want to make sure you're clear about the difference. ILF has 2 funds, the ILF fund and our transition fund. Ian, do you want to come in and clarify?
Yeah, sorry, I was half sleeping there. Yeah, so there is clearly an interaction between the transition fund, which is a short-term 12-month grant of up to £4,000 for young disabled people in transition aged 16 to 25, although you're 25 until you're 26. So it's contiguous with the other children's legislation around ongoing care and looked after and accommodated young people. So, or care experience as we're now calling it. So those young people who have little or no social work support, and that's the key here, are eligible to apply for that fund. So obviously the interaction with the reopened fund is that there are young people aged more than 16 in transition who would generally qualify for both. The differential is that if a young person has the threshold budget or the qualifying amount for the reopened fund, then they should apply to the reopened fund and not the transition fund. The transition fund, as I said, is only for 12 months. It's to meet 1 or 2 individual independent living outcomes that increase the young person's engagement and activity in the community. It's not about additional social care supports. In fact, we stay away from additional social care supports generally. We have funded them on 1 or 2 occasions for specific issues, but the support that we provide through the transition fund has to end at the 12-month mark. So if somebody's going to require ongoing support like additional social care, then it's the new reopened fund that they should be applying to if they have that threshold sum. And the other thing to say is that through the reopened fund, we can also provide some of the items and services that we would normally provide through the transition fund. So the things like laptops, driving lessons, that kind of stuff, whatever is deemed appropriate for that young person. We don't fund those generally, but they are available for specific purposes and for specific young people. Hope that covers it, Robert.
Yeah, no, thank you. Yeah, we'll double check. Did that cover it?
Yeah. Yeah, I was just thinking about when people leave school and suddenly there's a big reduction in the support that's provided, so they might not have the 800 at that point. So it's just thinking about that transition period. So it's not really a question, it's just something in my mind.
Yeah, the transition fund is obviously potentially available to that young person, and then when there is a budget identified, although yes, of course, it's the public money and public funds, we'd be making sure there wasn't an overlap, but I would encourage you to go for it. Leslie and then Katrina.
Yeah, it's just a quick comment on the issues Fiona's raising there about young people in transition. I think if the sort of proposed changes Peter had mentioned earlier about informal carer support make sort of a slight change to the threshold sum and the access principles, then a lot of those young people you're talking about probably would become eligible. So it's just sort of to keep an eye, out for any potential changes, because transition is a really difficult period for young people, and you want to make sure that they access all the support they can. So in the meantime, you could be looking at, accessing the existing transition fund, but keeping your mind open for come January for those changes to the reopened fund to make further applications. Am I right? That would be possible, because by that point the TF application would be complete.
Yeah, potentially. Yeah, that's possible potentially.
Thank you, Leslie. Katrina, hello. Delighted to see you from South Ayrshire. We've been missing Helen for a wee while, and she's been a long-term ILF lead stalwart. You're most welcome at the Leeds meeting too, Katrina.
My question was around, we have a few young people who at the age of 16 and they're open to children and families disability team who, through no fault of their own, end up in, let's say, homeless type accommodation. They're not children who we'd be looking to accommodate, and they've got some capacity for independent living but still need packages of support. And I just wondered if they would qualify for the transition fund, because they've not technically care experience, they've just become homeless at the age of 16.
Yep.
Do you want me to answer that, Robert?
Yes, absolutely, and thank you.
Yeah, so we treat care experience in the transition fund as almost as a protected characteristic under the Equalities Act, in that nobody goes through the process of being in care unscathed. So young people who experience trauma and adverse childhood experiences, we're able to equate that with disability. Which allows us then to make awards to young people who have care experience and who have some experience of those kind of symptoms and conditions. Young people who are simply homeless is a bit more difficult.
Sorry, they do have disabilities. They're open to the children and families disability.
Right,
so
if they have a disability, and then there's no issue whatsoever, they will be eligible. Maybe I'll just say a wee bit about how we accept proof of disability. So we have 2 ways of doing that currently. We can either accept access to a disability benefit. So we need an award letter essentially for the young person's CDP or their ADP or whatever benefit they happen to be on. And if they've got that in place, then they will meet the eligibility criteria, provided they meet the other 3, which is they shouldn't have any more than £35,000 in savings. They need to be in the right age range, and they need to be resident and present in Scotland. if the young person meets those criteria, then that's fine, and we've got that proof in terms of a disability benefit letter. The other way we can prove disability is having what we call our confirmation of disability template completed by a professional who knows them well enough. Within the Equalities Act, if you're familiar with the Act, only a very small number of degenerative conditions such as cancer, HIV and AIDS, MND, MS, Duchenne's muscular dystrophy, and strangely, type 1 diabetes are considered as disabilities at diagnosis. Everything else is just a condition. So we need a professional to confirm the effect of a condition on a young person. So it's not about the condition itself, it's about how it affects them and how they manage their day-to-day life. So we basically need somebody to confirm that they meet the 4 criteria in the Act, which is all contained in the template that we offer. It's downloadable from the Transition Fund website. And that then allows us to confirm that people who haven't been through, even young people who haven't been through a diagnostic process, but who it's very clear to a professional or a suitable professional has the conditions that meet the conditions for a disability under the Equalities Act, and we can act on that. That became really important during COVID when people weren't seeing doctors and weren't getting diagnosis, and it also kind of circumvents the waiting lists for NHS diagnoses as well at the moment. We don't want anything else that you can send us. We don't want diagnostic letters, we don't want school reports or anything like that. It's purely either that or the award letter from the disability benefits.
Great, thanks.
Thank you, Ian. Hello, Margaret. Good afternoon. How are you?
I'm all right. I nearly got there. I nearly get through a whole meeting without saying a single thing, but you know me. It's really just about the carers reduction. So the planned carers reduction, would that be in addition to any respite or short breaks that was in the package? Because at this moment in time, we can include any financial respite. So with the carers reduction, would it only be for carers who don't have, where there's no respite within the package, or would it be in addition?
So and if anyone else wants to answer, that's fine, because this is a work in progress. What we are going to ask through social work is that if this is agreed, that you identify those people who you think are going to benefit from ILF, where the carer clearly in a target group where there's significant carer stress, and there's and that then is regardless of whether they have a carer's budget, whether they have carer's allowance, it's not going to, at this stage, it doesn't look like it'll be tied into any benefit or any local authority process. They won't require a carer support plan. It's going to be your professional judgment that this person has resident unpaid carers, and you know that they need additional support.
So Margaret,
I think that could make a huge difference to our applications as well, where it's people that are, you know, if we could reduce it from 800, even just as people say, to 700, that would make a big difference. But this could make a huge difference to some families, just doing that, take the carers off, as long as having respite within the package doesn't make them ineligible.
Margaret, it's only a proposal at the minute, but the proposal is that the only criteria is that the care would be eligible for an adult care support plan, whether that plan's in place or not. As long as they're eligible for that, then that's sufficient. There's nothing more complicated to it than that proposed at the minute anyway.
No, that would be good. I think that would make a huge difference to applications.
Great, good to hear, because that was the purpose as well. Sharing information is to hopefully fire everybody up to go out and find an application and get it done and get it in, certainly before the end of the financial year, or there is the potential it's lost, and that's the truth. Donna, over to you.
Yeah, it was just a quick question, Robert and Peter, about the numbers, because we know that in terms of fairness, there's numbers being given to all the local authorities, you know, in terms of spreading it out fairly. But we also know, you know, that there's some that have got a lot and some that haven't got many. And we know at the end of the day, it's ILFS that make the decision about the award. Is it worth people putting in more applications than their quota? So if they've got 16, should they consider putting in more so that at the end of the day you've got more? Or is that just me running rogue here? But, you know, it's just a question. Thank you.
We like rogues, and I would, I would. I guess as ILF's Director of SDS, I shouldn't encourage huge amounts of over-application, but we would welcome the demand, to be frank. Sandra, I know I should have came to you earlier, apologies, because you've got a list of the current allocations for folk to have a quick look at. Just want to qualify that by saying this is the 7th of November. There are some local authorities that haven't made or made only 1 or 2 applications out of their allocation. If that stays the same, we'll have to look at reallocating those to the local authorities that can make applications rather than lose this resource. Now, hopefully that allocation will be back in place next year, but it is a risk, and certainly there's the risk of losing out on that vital additional social care income in your area for people who clearly need it. We know there's an underlying need there, and it's the pressure on you and in the system to find the time and be able to make these applications. But that really is a risk for you to take back to the office, is that these allocations might go somewhere else. So, Sandra.
Sorry, my question, we've had lots of conversations about the threshold. I'm interested to know from the group if there's any other reason or any other issues that are acting as barriers to the volume of applications, aside from the threshold.
Yeah, the threshold. I was going to say the threshold, the numbers, I've put a link into information page for local authorities from our website. It is a list of all the application, the allocation numbers. But as Donna was implying it, if I was in doubt, if I was the worker, I'd be putting the application in and asking for permission after. So, Alison, nearly out of time.
Yes, Robert. Just one of the sorry, in response to your question, Sandra, I think for us it's capacity, it's worker capacity. We issued lists to all our area teams earlier this year of those who met the threshold for people that could potentially be considered. We've sent a few reminders, but I do think it comes down to the capacity within the area teams to progress with applications. We've offered support, so we'll continue to push that to see if our SDS team can help. But ultimately, it's the worker that knows the individual, so it's better if they do it, especially if they've built up a bit of a relationship with the individual and their family up until now. But I think for us, that's the biggest problem. Thank you.
Thank you, Alison. And we do recognise and understand that. And I think, Sandra, you want to come in and say just very quickly about, we're nearly out of time, about what support we can offer in those circumstances.
Certainly, I mean, we've gone out to most of the area teams, as I mentioned earlier on, and we're quite happy to come to the individual teams and do a whole presentation. I've also suggested to some areas that we'll come and sit within the area team itself and support people in applications. We've also got a huddle in the central team where there's a number of different local authorities come together to talk about some particular issues to that relevant geographical area. And we're here all the time if there's any issues. I made a list of do's and don'ts actually, and one of the first ones is do make an application, and if you're unsure, then just pick up the phone and chat to us about that, because we're all really willing and able to chat to you about the application. Even if you're unsure, I'd rather you made an application or made a call just to make sure that actually it's an appropriate application, and we'll help you with that. So there's plenty of help and support. We've got the leaflets that's been referenced already. And as I say, the SDS managers that cover the whole of the country are there to support workers and yourselves as managers at any given time. So I'd rather that you made an application rather than hesitate or even have a conversation about that. As I say, we're happy to come to the team meetings as well, and I see we've had a couple of invitations from this already. I'm having some difficulty, Robert, sharing the numbers, but I'll get that. I'll send the link out post this.
It was to the information for local authorities page. If it's not there, I'll make sure we put it in.
I've got it here, but it's just no sharing for me. I don't know why.
No, that's fine. It's all right. It's on the
Robert.
Yeah, Peter.
Sorry, just to say, I know we're out of time, but Helen's got her hand up, and I think I saw another hand go up there.
That's Donna, over to you. I'm happy to take the questions. Helen?
Yeah, my question basically, Robert, is to do with the ILF portal, and I brought it up before with you guys, whereas us as an ILF lead, we cannot see what other applications have been submitted to you guys. And I can't see, and I'm having to email you, Robert, and Anne, to say what's our numbers, so I can report back to management how many we've applied for. And I can't actually see which services have actually applied. Is it LD? Is it physical disabilities? And that's really frustrating, because I'm having to email you guys to get the information when the portal's there. But I wonder if there's any more development on that.
It's a great question. It's almost like a page to prompt that. Our IT have advised yesterday that that any worker in a local authority should be able to see and actually view and modify applications which were started by another colleague, for example, if somebody left. So that's just happened in the last few days, and we'll send out some formal communication about that.
Okay, because I couldn't see it yesterday when I was doing some care schedules yesterday, so I couldn't see any applications on it yesterday when I was on the portal. So that's why I thought I'll bring it up today.
Thank you, and I will speak to our IT and get something formal out to you.
Fantastic. So our one last question from Alana, and then we'll close up. Thank you for your patience. Great questions. Come on in, Alana.
Just on the back of what you were saying, Sandra, I think that would be a great idea if I could arrange in each year 6 teams to have somebody from ILF even just sitting for a morning or an afternoon to say, this is the time that an ILF advisor would be there to support you do some applications. I really think that on top of all the work that we're doing, that we would see a significant increase if I say this is your time and day, really think about applications on that day, because I do think maybe some of the workers who are a bit frightened of technology is maybe just using that as an excuse not to do it. So if we put that in, I do think we would get a big increase. So is that possible, and who would I be best contacting to arrange that? And just yourself, Sandra?
Myself in the first instance. We'll get some details and we'll get something set up so we can coordinate with the maximum number of people within the office at any given time.
Excellent. I'll do some groundwork then to see best days and times for each localities, and I can put that to you then on, and we could organise that. But I do think that would be a massive help.
Yeah,
thanks for that.
Happy helping out when we can.
Can I just say that if anybody needs that on an individual basis, our digital team have said that they're more than happy to do that. So if somebody's sitting for the first time, a few applications or whatever, or even one, they just need to contact and arrange to do that, and somebody from our digital team will take them through that. So but what Sandra's talking about, if you want to set up specific days, then that would be good, but they can provide individual support just now.
I suppose it's about the content as well, about what we're looking for, about how the application's set out as well, and with the information that we would need to allow that application to go forward, and along with the digital team certainly. But the application process is actually very, very simple, very simple form, and its access is very simple as well.
That's great. I'm really, really sorry, guys, but I did promise that we would try and finish at 30:30. But I just want to say that obviously by the questions that we've got and the interest that we've got, there's room for more sessions, and we're very, very happy to set them up with ILFS colleagues. But I want to say a huge thank you to people for giving up their time and showing their interest, to our Independent Living Fund Scotland colleagues for that offer of support. Not only personal support, but also just coming to visit, to IT, to open badges, to real practice development. So thank you very much for that. This has been recorded. We'll make sure that you've got access to that recording as a tool for talking to colleagues. And then, as I said, we're very, very happy to follow up with additional sessions. And we know that also that the Practice Network is there. So just on behalf of ourselves, the team, and Independent Living Fund Scotland, a huge thank you. And I hope you have a really good rest of the day, and here's to a lot more applications. So thank you very much. That's great. Thanks a lot.
Thank you.
Thanks a million.
Bye. Thank you. Thank you.
Bye.
Bye.